So welcome everybody. Thanks very much to all of our speakers gathered here this morning and TCH Alliance for working with us on building out not only this workshops, but a series of workshops. We're coming to the end of this particular series, which has been around data security, and I suppose we had regulation as well, all required and all needs that we've come across as DConnect, speaking with many different businesses, large and small, over the last number of months. I'll just give you a quick presentation from myself at DConnect. Angela Duffy, Programme and Business Development Director for DConnect. We're a digital health innovation hub established at Dundalk IT. And we have, I suppose, been up and running for just the last number of months. We have been supported absolutely fantastically by Enterprise Ireland and a number of businesses and funds, and also local government in this region. It's been fantastic support. We had our launch about a month ago now, and it was very well attended. We've been busy with the workshops, which have also been well attended, and a lot of interest on digital health across Ireland and overseas. So our mission really is to stimulate, foster and enhance innovation in digital health to create enterprises, products and services that address the growing needs for healthcare in society. So as we have an aging population, we have an increased burden on healthcare right across the globe, and that will continue. And I suppose digital health is being looked at as an opportunity to help to address those needs and maybe decrease the burden at the hospital and clinical setting, and maybe move some of the care to the home and self-management and self-care. So great hope for digital health, and it's been accelerated obviously for the last 18 months or so with the pandemic. So it's great to see that there's such an interest in it from the large corporates and right through to the early stage companies and even the third level institutes who are coming up with more and more new exciting technologies. So we're building a bridge between those businesses, some of whom are digital already, some of whom are large businesses who have adopted and are, I suppose, pioneering and advancing some of the technologies, who are acquiring some of the smaller businesses, and then understanding the needs of the healthcare. So we have a lot of alliances with public and private hospitals, and looking at the needs firsthand, working with society and community as well. The end users are the patients who hopefully will have access to healthcare from the home and to their carers from that situation at home. And with all the innovators and entrepreneurs out there coming from universities and otherwise. So we have created a cluster across the connected health and wellbeing space. We're supporting those early stage startups and scale-up companies, helping them to commercialize their work and their businesses around digital health, helping third level institutes to commercialize their research, and also providing the larger businesses and investors with access to innovation and cutting edge technologies for the future. Our audience is quite broad, really. This is the quadruple helix model. I suppose this particular one has come out of MIT, but this is used all across the world. And this is our own take on it. We're working with, as I said, the entrepreneurial community. And of course, they're supported by capital from investment and I suppose VCs, angel investors, but also a lot of it from government as well, particularly Enterprise Ireland, who are our main funder, who play a major role in Ireland. And then overseas as well, lots of opportunities now with the New Horizon for people to have a mix of, I suppose, grant funding and equity funding. We also work well with the HSC here, and they're very much moving towards digitizing and bringing in innovations in care. And I suppose all of this activity, particularly at the university and entrepreneurial level, is of interest to the corporates and the SMEs who are looking to, I suppose, transition business, move to the forefront and roll out some of those new technologies. As I said, we have our cluster, which is building, I suppose, day on day. We had a lot of people, that we've spoken with to date, a lot of people attend, and we've been very busy after our launch. We have a hub, as I would say, a knowledge hub, where it's a go-to for people. We ourselves probably have quite a bit of experience as a group in terms of I suppose, corporate, entrepreneurial investment, and just mentoring and guiding businesses. So we'll really be able to not only support you ourselves, but link you into our larger community to avail of the expertise that you need. We're helping those smaller businesses and even sort of SMEs who are maybe moving into healthcare or who are digitizing, supporting them through mentorship and programmatic and workshop activity. And then really some of the webinars that you're attending, for the last number of weeks have been around digital transformation. And that's, everything from, a GP office bringing in software to help with how they're scheduling or managing operations through to the needs in the community, with seniors training to use some of the technologies that are now available and being able to connect with their carers more easily. From any perspective, we're all global at this stage, and it's great to have eCH Alliance supporting us and working with us. Their reach is very broad, and I think Andy will speak to that later. But from the outset, I think every business and people need to be thinking about the digital era and the digital world that we live in, and being able to go global from the outset. This is the team, myself, working on programs and business development. My colleague Sarah, who manages our community and education. Sarah, who is our technical expert and actually does quite a good bit of prototyping and working with companies on that expertise. He has a background also in regulation in the sort of medical device and software side of that. So deep expertise there, which is also probably a known expertise out of Dundalk IT. And then Aidan Brown, who leads up the innovation at Dundalk Institute of Technology as well. Feel free to reach out to any of us at any stage. I keep saying that, and people do. So after every webinar and after every launch event or whatever we have, a lot of people do reach out. And that's what we're here for. We want to be the go-to, as we say, to help you along your path, wherever it is, if it's going cross-border into new markets, if it's digitizing or prototyping, if it's for knowledge or connecting you with others whom you need to in the network. That's no problem at all. And so email us at dconnect@dkit.ie and we will pick it up from there. As I said, we're coming to the end of this series of workshops and we're moving into, I guess, the summer. We're probably going to have a few less because we're hoping that everybody gets a break over this summer and takes some holidays. But we do have a very good workshop coming up on cross-border opportunities and funding on the 12th of July. We work with eCH Alliance on that, and their reach is extraordinary. So the knowledge they'll bring to the table for that webinar will be well worth tuning in for. That's it for me. And I will hand over to Andy to give a little bit of background on eCH Alliance.
Good morning, everybody, and I hope you can hear me. Welcome to today's session. We're focusing, as Angela said, on eHealth and digital transformation today. And what we wanted to do was bring from the whole of the European Connected Health Alliance ecosystem network some best practice examples, and we're really pleased that we've got best practice obviously from within Ireland. Two great speakers from the HSC with Lorraine and Maria as well, but also we brought in the experts from two of our shining star ecosystems, both within Slovenia with Mojca, who heads up the Slovenian ecosystem, but also from Croatia we're pleased to see Hrvoje here, also from the Ministry of Health. Long time since I've seen you, Hrvoje, and good to see you again. But for those who don't know much about the European Connected Health Alliance, I just wanted to give, because obviously we've got a few new people here today, I want to give a little bit of an overview about the European Connected Health Alliance. I've got a few slides and we'll be happy to share these with people afterwards as well. But for those people who don't know us, we're a member organisation, and we have now approaching close to 850 organisations who've joined us. They join us because they want to connect. We talk about being the global health connector for the European Connected Health Alliance. These are organisations which come from a wide variety, all concerned with health. I'll talk about some of those in a moment. We also reach out to a large number of experts across the globe, where we use our international network of ecosystems to actually physically to connect up some of those dots. Unlike today, to connect up and bring in expertise and best practice from outside of Ireland as well. We've also got a large number of other services we provide for our members, but people join us typically because they want to get involved and stuck into that network. They want to promote their organisation. So very, very useful perhaps for yourselves to think about that, to think about how we can help promote your organisation both within Ireland, cross-border into the UK as well, and into the north of Ireland. We've got ecosystems dotted around all over the UK, but across a wider network of around 65 ecosystems we've got now. People also want to join and get involved with funding and collaboration. As Angela just hinted at, we've got a special session with some of our best in field practitioners around funding coming up on the session in July later. Our members tend to be mostly 90% not-for-profit organisations. So organisations that are government bodies and ministries, both of health and social care, but also importantly economic development agencies as well, because they get the value of healthcare to the local economy because it's the largest spend. We also have a really huge network of universities and research organisations, now approaching around 230 different academic organisations, which also want to collaborate and get involved, and a bit like DKIT, also produce some great spin-outs as well. So, and we're proud to work with those too. Our network also contains around 120 different hospital organisations too. So we've got a wide variety there of need, of policy, of academic excellence, but also a large number of companies, some of which are based in the Republic of Ireland. We work with and support because they want to get access to both procurers, but also each other, because they want to work and collaborate together. One of the other nice things about the European Connected Health Alliance is we have a large number of patient groups who are members of us. And these can be either locally based, but also national organisations and sometimes umbrella organisations. So they bring them with themselves, perhaps smaller, more local groups that have combined together as part of a patient group. They're essential for getting contacts with people who can actually express what their needs are, whether they're carers or people with certain conditions, for instance, such as a rare disease network or stroke association. We bring all those people together, all those different players, into our ecosystem. And we have ecosystems, as I said, all over the globe now, but all of them are different, and that's good. But they all have that underlying key principle of leading with a need, with all those stakeholders that you can see in front of you who are participants in health, but lead with a need, and also there to break down some of the silos that are there in health and social care, where people don't talk to each other, they don't share best practice. We've created a whole network of these ecosystems. You can see some of them here today, and we're proud we've got Croatia and Slovenia here as well, because they get the benefit and the value of collaboration. So I'm not going to talk anymore about the European Connected Health Alliance. I'm going to go straight to our first speaker now and introduce, to bring in some excellence from Ireland, Lorraine, who's going to talk today and hopefully bring, I think, a really good level of understanding around eHealth and digital transformation. Lorraine.
Hi guys, how are y'all? I'm just going to share my screen here. I am Lorraine Smith, the Digital Innovations Communications Lead within the HSE. So, yeah. Now, can you all see that?
It's coming, yep. Perfect.
Okay. Go around. Okay, so. just, there we go. Sorry. There we go. Now, can you see our 5 pillars of digital transformation?
Yes.
Yes.
Okay, perfect. Okay, so the first pillar is, this is our overall strategy. And the first pillar is our digital academy. Now, the digital academy supports our colleagues with a suite of learning tools, from the digital starter pack to the new HSE masters in digital health transformation. And one of the things I've worked on in this is I just finished a gold build on a new HSE learning program, an online program in HSE land. And this is a digital health transformation course for our staff. Now, this is a very exciting showcase of some of the very recent digital changes taking place within our system. The second pillar, Digital Academy Forums. Now, this is something that Martin and I are co-founders, Martin Curley, Professor Martin Curley, who works in the digital transformation team. He's the digital director. The two of us started up the Digital Academy Forum together, and I'll talk some more about that later on. So the second thing is, that's actually a TED Talks type system where we socialize digital ideas to the general wider HSE. The next thing I'll talk about is open innovation. Now, open innovation for me, that entails, I work very closely with the Department of Public Expenditure and Reform in Ireland, and we have a thing called Our Public Service. Now, for Our Public Service, that basically I'm the Action 6 team member on that, and that entails me dealing with other civil servants and public servants within Ireland. So I deal with the likes of the Army and the Guards and county councils within Ireland. And what we do is we get together, it's kind of like a think tank to promote digital innovation within Ireland. And recently myself and Martin wrote the strategy for the HSE for digital innovation within the HSE. Now, the next pillar is our digital labs. So we have 20 digital labs that have been established nationally across Ireland, and they accelerate and co-create the adoption of digital solutions. Now, these are not people in white coats going around in labs, these are virtual labs. So when something is happening in one of the hospitals that's a digital, kind of innovation, what we do is we link them all up together under the heading of digital labs. And recently, one of our digital exemplars, Ashton Gannon in the Sligo lab, was recently shortlisted for a Digital Towns Award, and we were very proud of that. Now, the next one, digitization and disruptive technology. So that promotes the digital first culture where staff engage, and we educate staff, and it's engaging staff when there's different developments happening within digital technology. So now, there we go. So now this is the digital transformation pipeline pre-COVID. So as you can see, we had a few things going on there. Now, this is actually what we call the Big Bang disruption from COVID. So as you can imagine, things accelerated. We were thinking that we wanted Ireland to go from a laggard to a leader within 5 years, but actually we think that we've developed so much within the last year and a half that it has gone, progressed really well and at speed. So if you see the next slide here, this is what we have managed to bring forward, all of the ideas that we have managed to bring forward because of COVID. And normally what would happen, you know, we have like an exploration, proof of concept, a demonstrator, and then we go to wide use nationally. But we've been able to do this like just at speed, and we have like a massive amount of projects there. So this is one of the projects that I will talk about. So this is the COVID patient monitoring app, and this was developed with ourselves in the HSE and a company called Patient Empower. This was COVID monitoring app for patients during the pandemic. So basically what happens is a patient, if they have mild or moderate symptoms, is discharged from hospital, and they're sent home with a pulse oximeter, which reads the saturation level. That is a Bluetooth pulse oximeter, so that connects to your phone. Now, the phone is connected to a dashboard in the hospital or to a PC in a GP surgery. So what happens is if your saturation level drops below 94, there's an alert sent to your GP or your clinician in the hospital. There's also alert sent to the patient telling them to contact each other. And it prevents patients becoming hypoxic when they have COVID. And it has worked really well. We have prescribed this to thousands of patients across Ireland. So now this is the rapid adoption of this solution. So we had it in 20 hospitals across Ireland. We also had it in some hubs. We had it with the homeless community and we had it with the Roma community. So this is all of the counties within Ireland that have had remote monitoring. Every county in Ireland, including the 4 Aran Islands. Now, I think that this could be one of the only countries in the world where they actually have remote monitoring in every county. And actually the NHS contacted me and asked me, how did we do it? Because we were able to get it out nationally across every county. Now, this is some of the feedback from some of our senior management. COO Anne O'Connor said it was a groundbreaking initiative, and Paul Reid, our CEO of the HSE, said it was one of something to be proud of, the patient empowered COVID monitoring. So this is the health economics of the COVID monitoring. So if you look on the cost of a bed night in a hospital, it's normally between 800 and 1,000 euros. And we modeled our cost value analysis on that. So on the amount of bed nights by the amount of people that we had on COVID monitoring, what we saved for the HSE was 20 million euros. Now, I don't think that there's many people that can say that they saved money during COVID rather than had to, provide funding during COVID. So I think this is a really, really good thing. So just the team and Patient Empower were excellent to work with, and this is something really groundbreaking. Oh, now I'll just tell you about I'll give you an overview of some of the things we do. So this thing here is called a closed loop drone delivery service. Now this is a world's first. What we did was we tried to look at from the start to finish a patient's journey using digital. So we started off that they had a two-way interaction with their consultant. So we used an Irish company called RedZync, Blue Eye Technology, and that's a two-way patient consultation on their phone. So the patient talked to the doctor on the phone, and he then prescribed what the patient needed. Now, that was done through eScript. And we were actually involved with the government in changing legislation so that we could use eScript in Ireland. And the HSE digital transformation worked on that. So that's us there with the drone. So basically what happens is once the prescription is ready, it goes into the drone and it's delivered to the patient. Now this happened in Moneygall in Ireland. And there is Fidelma there. You can see Fidelma, she's 70. She thinks it's absolutely brilliant. This was picked up by the BBC Click programme, so you'd probably be able to see the video of it on the BBC Click programme. It was also picked up by RTE TV, and they were actually going to put it out on TV that evening. But I had a call from our CIO, Fran Thompson, and he said to me, Lorraine, leave it because it's during COVID and the people are cocooning. And if we put it out on TV tonight on RT, what will happen is HSE Live will be inundated with people saying, listen, my mother's home alone and she needs her drugs, and my granny's down the road and she needs her drugs delivered by drone. So what we did was we did the pilot project at the time, and we held off until the COVID was open. We were more opened up so that we could show it. So it has been on RT since. But this is a world's first, and it's a drone delivery service, a closed loop delivery service using everything digital. So that's one of the things that we did within the digital transformation team. Now this here is me. I hair changed during COVID. So that's me there with Violet. Now Violet is a COVID killing robot. So as you can see there, that's the prototype of Violet, and you can see I have a remote control. So that's at the very start. This is a Cara Robotics, which is another Irish company, and they're really flying. They're doing really well. This thing is faster than human cleaning, 3 times more effective and cheaper. It kills COVID. It also kills MRSA. Now, the picture on the right there is where we have it. That's the prototype there, you can see, and it's remote control. On the right-hand side, it's autonomous. It works on a track, and we have that one there now in Tullamore Hospital as we speak. Now, I think this is something really exceptional. And people have said to me, you know, oh, you know, robots and hospitals, like, I mean, you know, where are you going, like, you know? But the thing is that I don't see why Ireland can't be a leader in this field. I can't see why, if we looked at this and we seen this going on in Japan or America, we would be saying, this is brilliant. Like, look what they're doing. But why can't it be Ireland that people are looking at and saying, this is brilliant, look at what they're doing? So I think this is really exceptional. So now back to the Digital Academy Forum. So this is the Digital Academy Forum, and it's sharing, solutionizing ideas, and it's really successful. And it really opened up the whole, what was going on within the HSE, the digital transformation change in the HSE to the HSE staff and to the ecosystem. And it's been really lauded. And this is one of the things we had at the Digital Academy Forum. So that's Martin Curley and myself, and this is Stevie. Now, Stevie is the brother of Violet, who is the other robot, and this is Cara Robotics, which is the Irish company again. And they made Time magazine, and this is an assisted living robot. So what this does is it goes into like nursing homes, and the screen there you can see with the face, that lights up, but that can also act for like a two-way interaction. If you want to do a Zoom call with family, you can do it through this robot. The robot will tell the patient when it's time to go to dinner, you know, did you take your medication? You know, all of these things, and you know, the bingo is on now at 3 o'clock. Are you going down? It reminds them it's an assisted living robot, and it's been really you know, really welcome. And the thing about this is it also, one of the children's hospitals is looking at bringing this one into the children's hospital as well, because you have to be in a room with this robot, Stevie. It's absolutely amazing. If you want to see grown adults turn into children, go look at Stevie. The amount of people that have come to me after and said, do you want to speak at something, but bring Stevie with you? They just love them, from the service staff to the national directors. People just turned into children looking at this thing, and it's absolutely exceptional. And well done to Conor McGinn and the team there. Now, this is because innovation and inclusion go hand in hand. When I started the Digital Academy Forum first with Martin, I found that the gender balance wasn't really good. We have 80% of the staff in the HSE are female, but they didn't seem to be, you know, portrayed as being really, you know, the professionals in digital. So what we did was I said to Martin, you know, we need to do something here. So we did a power hour of, you can see Diane is in there, Diane Nevin, a power hour of the women in digital within the HSE. And this was really important to me. And one of the things we're going to do in the future for the Digital Academy Forum is we're bringing in, there's a school in Dublin 8 that's a female school, and we're going to bring in the transition years when we're doing our Digital Academy Forum, so that they can see digital transformation is for women too, because, you know, I don't think women are promoted enough in this area. So this is from our digital transformation team. This is the awards we have so far. So the Digital Academy Forum won Irish Healthcare Winner Award last year. The two-way communication from Reds Inc. with the HSE won the Irish Healthcare Awards last year for Best COVID Response. The Best COVID Response for Public Sector, we got a commendation, we came second only to the National Ambulance Service, but we don't mind that at all, because we think the National Ambulance Service are first class and brilliant. So the Patient Empower app that I worked on, that came second to Reds Inc., who we were working with anyway. So, like, I mean, we were very happy with that also. Now, we've also got a global award for innovation SMEs from the International Chamber of Commerce, and we're very proud of that. That's only the second time ever that's been won for Ireland, so we're delighted with that. Now, I was telling the team earlier, one of the things I'm doing at the moment I've been seconded over to the COVID laboratories for logistics. So I'm the logistics lead at the moment for the COVID laboratories, and I'm working with Deloitte. And one of the things that that we've done in between the two teams on a cross-functional team, what we've done is we've introduced this sample pat. So sample pat, I mean, sometimes it's the basic, simple things that really work. This is an app. It's an app on a phone. If you go to get your COVID test done today in the testing centre, what will happen is your bits and pieces will be in a bag with a barcode on it. The barcode is scanned. Your test is then scanned. Once we have your test scanned, we can follow your test from right away from when you're tested, right away into the lab, right away to your results. And this is brilliant because it's like you can see the data of what's happening with your test at any stage. So this was done by the Deloitte team and the HSE team. So I just have to mention John McQuillan and Rachel Marr and Jennifer Anderson. Now, you would believe that Jennifer Anderson is an actress, but she actually works in Deloitte, and she's brilliant at what she does. So the team in Deloitte with the HSE work together to get this. And it just goes to show you, like, I mean, you think that this is just a logistics thing and it's just a digital thing, but the human aspect of it. On Friday, we had a child that was being transported by airplane for care in a different country. And we had the nurse on the plane that hadn't received her test back to say that she was negative so she could fly. And we were able to go in through sample pat, pull the test, send it to her phone, her confirmation that she was cleared to fly, and they took off with the child to further healthcare in another country. And it's as simple as that. The fact that we could track it and it's there, it's just brilliant. But it's the simple things that sometimes just work really well. So, so that's the end of my presentation. The only thing I will say is the HSE Digital Transformation team have a web page, and on the web page is a link there for anybody who thinks that they have digital transformation ideas that they want to come to us with. And our Twitter page is at HSE_DA, and my email address is there also. So if you have any questions or you want to come and talk to us, we're open to discussions with anybody who has any ideas in digital. And thanks very much, everybody. And
thanks, Lorraine. Fantastic. Super, very, very innovative. Lovely to see those examples. And I think you're right. There's going to be a change in the way we do things. So lovely to see that.
Excellent. And I also think as well, what a brilliant segue to say, let's start about this across the rest of our network, because that's certainly an example of being a digital lead, and definitely not anything to do with being a laggard. So fantastic. And there's so many, so many of our ecosystems are interested in robotics or drones, and I think there's a great way of getting that level of connectivity. So thanks for that, Lorraine. Brilliant, absolutely brilliant. Our next example from our ecosystems, we're going to get on a small plane virtually now and hop over the sea to Slovenia and welcome our ecosystem lead there, Mojca, who is leading the Healthy Day ecosystem in Slovenia, which will give you an overview of a different level of eHealth transformation. We've been involved with the Slovenian ecosystem ever since it was created. I was there at the launch of it many years ago, so many that I've forgotten, but it's a really, really exciting and innovative ecosystem that likes to connect, a little bit like with Ireland. So I think there should be some great examples. Mojca, over to you.
Thank you, Andy, for such a lovely introduction. It's always a pleasure, and I'm very honored to be today with you. Just let me have a few words about me. I'm Mojca Cviran. A few months ago, I joined the leading company providing IT systems for healthcare in Slovenia. Our market share for hospitals is about 85%, and for primary care and private healthcare providers, approximately 40 or 50%. Prior to that, I was co-leading the healthday.c ecosystem together with Gregor Cuzak, who is a coordinator of ecosystems on a level of eHealth Alliance as well. And I believe you all know him. And the Healthday is a community of health tech innovators and stakeholders who want to or strive to co-create the healthcare of tomorrow in Slovenia. And we are also a digital innovation hub. We became that 2 years ago, and we are having a program for startups and companies along with the, our voice in a community of stakeholders. Nowadays, I'm not a leader anymore. I'm just a member of think tank, and I still contribute actively. I have listed, I don't know, do you see a screen?
Yes, we do. We can see it.
Yes, sorry, thank you. I listed some short overview of ecosystem, healthcare ecosystem in Slovenia, and some highlights, not necessarily connected to digitalization, just to have a short overview that we have a public healthcare system which still provide high quality level of care to citizens and long-term residents. What I would like to mention is that the part related to funding of healthcare in Slovenia is managed by Health Insurance Institute of Slovenia, and the part related to digital eHealth is actually coordinated by National Institute of Public Health. Both are working under the auspices of Ministry of Health. And what I wanted to mention here is that each citizen has health insurance card, which is kind of ID health card. And whenever I submit or provide my ID health card to an ambulance or hospital, I give them, I allow them to access my digital data, like my personal data, like gender, access to my personal data, like gender, address, etc. What is the status of my health insurance? Who is my chosen personal physician? Or which are prescribed medical devices I'm using, prescribed medication, maternity procedures, etc. And also some consents and commitments like for voluntary post-mortem organ and tissue donation and or transplantation. So this ID card was years ago, more than 20 years ago, the first step toward the digitalization or digital transformation of healthcare. And I think it's quite unique because we can be easily identified and all our data gathered. And it's also useful nowadays when we have also a central eHealth portal. And how our ecosystem looks like. I will concentrate more on what is the status of our healthcare, digital healthcare ecosystem. We have eHealth platform, which is on one hand represents environment in which the information system of systems of individual healthcare institutions are connected through, and through which patients and physicians can access several data. Altogether, I think that there is approximately 20–25% all medical data is stored in this central platform. It's quite a huge already, and on a national level, it is agreed which data should be reported and stored in this platform. However, it's going to be upgraded in the next period hugely, because it's during the COVID, we really noticed that there is a lot of benefits coming out of when you can out of those systems. Then, of course, we have local information systems. Each hospital is each public primary care home has own, and then there are several subsystems and all the digital med equipment which has own subsystems. And just to let you know, or to give you an example, on the level of one hospital, how this part of system is fragmented. For example, in University Clinical Center of Ljubljana, I think they are using 29 or even more different information systems, which are integrated with one another, but sometimes not, of course. And there we have also a number of solutions, apps, tools that support the daily management and operation of e-health care institutions, such as accountancy, etc. And the special category which should be mentioned is telemedicine and all apps and solutions supporting remote consultation between a physician and patient. Both categories have proven to be effective at a time when access to health services is limited, like in COVID period. And I believe they will set a new standards of service and communication between physician and patient also in this new normal period. I have to mention that a year ago, also the remote consultation was listed among payable services in Slovenia. And that happens in a few months, because usually all these changes which health service could be listed as a payable in a public health system usually those are very long procedures. These are key eHealth components. This slide is in English just to have a kind of overview how our central platform eHealth looks like. But what I would like to give you is more in detail what kind of data we are exchanging and what is the scope of central registry of patient data we are using as a patients and as a doctors. This slide is, I mean, those components here are in Slovene language, but still the scope is that data and documents to be exchanged or shared between healthcare providers through these platforms, as well as to be available to the patients. And I will also show you my medical record, what I can see as a patient on the next slide. It's a short-term storage for exchange purpose, meaning that there are different levels of authorized access to those data. For example, the primary care physician has all the access to all the patient data, but when you are visiting hospital or specialist and some other doctor, they got limited permission to access certain data. The key services we are having is for example, e-prescriptions, and nowadays 95% or even more of all prescribed medications are going through this service. Then we have a central registry of patient data, which is the main exchange platform, when we can see our latest examinations, lab results, including all vaccinations, then e-referrals, etc. we also have e-referral, and we can digital make an appointment to the selected selected specialized services, health services, and all the services related to kind of telestroke, this is teleconference, system for emergency treatments are also connected to this national platform. There are electronic registry of vaccinated persons, references to primary healthcare, teleradiology, and e-communications about reporting injuries. And there are also services for consultation between physicians, like consultation between a primary care physician and specialist in some medical practices. And what I can see as a patient, this is my medical record, for example, and here I can see and download and print out all my tests related to COVID. I can see that I've been already vaccinated here. Then I got an appointment for some urologist, and I already did my. I'm still waiting for examination to be uploaded, and then what kind of medication I'm using, and some other documents and test results, etc. We already can access to our digital COVID certificate, and I'm also notified whenever some document is coming to my medical record. And as Lorraine said, impact of pandemic on e-health was huge. There was even in Slovenia rapid adoption of innovation, digital tools solution. But what I would like to mention is also that also from the point of view of service providers changed a lot. Somehow the solution development processes change, because all the solutions should be implemented fast, in few days, in 2 weeks, for example, to support mass screening or mass vaccination, or supporting information on test results, etc. All the solutions should be simple, intuitive, easy to use by the medical staff, and also somehow develop in accordance with their digital skills, because there was no time for long-term education or preparation on how to use certain tools. It was all about real-time data management, and also it's already seen that many of those solutions will be also used for a different purpose in new reality. For example, I will give you some examples. We also introduced remote COVID patient monitoring. All the patients, the patient who had COVID and were treated at home, and those with a bit stronger effects, let's say, was monitored with similar devices as Lorraine showed, and the first pilot was implemented in Ljubljana University Center clinic, and then a few other COVID hospitals also adopted this service. Then there was a mass screening PCR and HTA and vaccination administrative support. The mobile app was developed by our company, and it was merely about administrative support and logistic support to the mass entering points for testing. It was if in past times it was impossible to easily connect different databases or access databases and integrate some data sets into all in automation processes. In this COVID time, this was very easy. In 1 week, the application was developed, tested, and brought to the market. And yes, it was about pilot. In healthcare, there was it's about the security. It's a high level. Sorry, I saw Lorraine and I was thinking that she's making questions. Sorry, and it shortened the time of entering. If the medical worker on entering point is entering data manually, it usually takes 5 times to process 1 patient. And if you have a mass testing point, this is impossible. So the application shortened the process to 5 seconds. And also all the test results were directly transmitted to the central eHealth platform, and then each individual was informed about the result with text message. Then there was also available by National Institute of Public Health new authentication login to the central portal, which means that you don't need anymore the digital signature to enter your medical data. That's all from me at this point, and I believe there will be some questions about impact later on during our conversation.
Thanks for that, Moita. Really, really wide view of some of the changes and transformation that's happened within Slovenia. And it's a long time since we've spoken. Obviously, you've moved now with Infonet, but it's still good that you've got that such a higher level picture of transformation within Slovenia. So please, all the people who are sat and listening to the call, if you've got questions, you can pop them in the Q&A session below. Yeah, I think, you know, we've heard from one speaker from Ireland now. We've heard from seeing the excellence there, and then the excellence within Slovenia. So thank you for that, Moita. And we'll do questions and everything at the end of the session. So we're going to move on to our next speaker. I'm really proud to introduce Hrvoje from Croatia. I've met Hrvoje a long time ago in Helsinki. We've worked very closely with the Croatian ministry during their presidency of the European Council. But also now we're proud that we've got within Croatia our first ever ecosystem in Croatia, which is fantastic. And so we're going to move just slightly sideways to connect up from Slovenia to Croatia. Hrvoje, over to you, please.
Thank you very much, Andy. Thank you. It's my pleasure to be here. Good morning, everybody. I hope you hear me well.
Yes.
I will try to share my presentation just to see how to do it the best. Let's go like this. And if I put it on full screen,
That's fantastic.
it's okay, great. So please allow me to share with you a few examples that we recognized. Actually, COVID, of course, being a crisis, also showed as an opportunity to boost some of the business processes in healthcare, and of course speed up some of the digital transformation uh, we all care about and we all deal with. So it will be high level, low level examples interchange. So please bear with me in the next few minutes while I show you these examples. So just because it's my first presentation within the EHA Alliance, when we have the ecosystem now, when I talked in Helsinki a few years back, it was all about the presidency. So please allow me to show you some numbers and some dimensions of Croatian health system, just for you to get the sense of the how the system is shaped. So of course, Ministry of Health and Croatian Health Insurance Fund, two, let's say, main bodies dealing with regulatory and financial issues for healthcare in Croatia. We have a few public institutes and agencies for public health, transfusion medicine, medical devices and products, and of course, emergency medicine. We have part of public hospitals and hospital centers, and of course, private part of it that also contributes in healthcare. We have a central eHealth platform that connects all the actors providing healthcare, and the main operator of this CESIC system, so central eHealth platform, is Croatian Health Insurance Fund. Just to get a sense of the numbers, we have around 60 hospitals, more than 2,000 GP offices. I think around 150 labs now during COVID, and of course pharmacies, dental practices, and all other specialist care offices, all connected to central health platform, eHealth platform, exchanging messages, HL7 messages to provide data necessary for providing healthcare. One important point from the legal part is the Health Data and Information Act. We prepared for the Parliament to be adopted, and it was adopted in February 2019. It was pre-COVID, but it actually enabled us to speed up things in terms of digital transformation in Croatia, and actually put a lot of things in their place in order to enable us to speed up e-health development. To give you the short overview of the services in eHealth, we have a full nationwide production of e-prescriptions in Croatia from 2011. So it's 10-year anniversary now, practically. A few years after that, we introduced the e-referrals from the labs, and after that from the specialist healthcare facilities. And we implemented e-schedule lists and e-booking in 2013, and eHealth records came in 2016. eHealth records, as a, let's say, as a final touch to provide the data for both healthcare professionals and the citizens, is still, so the popularization of this functionality of this part of the system is still ongoing, and still we are finding the ways how to make it more attractive to the both the professionals and the citizens themselves. So we add more features to the citizen portal in order to provide the data to the citizens, and of course COVID crisis and COVID developments actually made it more interesting for the citizens to have their test results and their vaccination information online. I will not go deeply into details of the EHR, but just let me show you the picture that all the data are stored centrally, and of course the system is implemented, let's say, multi-layer security, enabling authorization of health professionals via smart cards they have, and also citizens to access their data through citizen portal by choosing any high security credential they might have, for example, bank token or some other EID credential. I mentioned a few times already the health portal, so the citizen portal. There is an accompanying mobile app to that. And just recently, we have upgraded both versions for Android and iOS. So to level up the functionality that is offered through the web version of the portal to be offered also to the mobile app version. And just to go quickly through some business process business processes being transformed during 2020, so during COVID. So of course, sick leave data exchange has been always, there was always one more paper to be shared with somebody within the process. And during last year, we actually finished up digitizing the whole process by interconnecting some databases and making more efficient some steps within the process to avoid delivering paper reports on sick leave to the Croatian Health Insurance Fund. So it's safe to say that actually COVID was a final push to digitize the whole process in that sense. Also connected to that, there is a eHealth service for employers that actually enabled them to use Croatian Health Insurance Fund web portal for exchanging the data, and also avoiding the need to deliver any paper forms as such. E-referrals, big part of health services in Croatia. Also, paper version of the referral was killed finally last October, and I think nobody misses it, and it should be done. It should have been done earlier, but another example that COVID made it happen as a final step of digitizing it. E-orthopedic aid. So the approval of the orthopedic aid for citizens is still ongoing to be digitized completely, but already one-fourth of the products. So it depends on the experts from that side to make all necessary prerequisites how to digitize the whole process. Is already working without providing paper forms in that sense. We hope to get with e-orthopedic aid, we hope to get e-prescription kind of process at the end of digitization. I mentioned a few times e-prescription. We have implemented the cross-border e-prescription and patient summary services exchange. During the last few years, we work very hard with other member states in the joint project to exchange these services cross-border. So with Czechia, Finland, Malta, Portugal. I hope I haven't forgotten anybody. And the work is still, of course, ongoing. There are other member states joining in. from in the next waves. So we'll see how will it go in the next few years. And of course, what really makes sense here is uh, to have sensible business case between neighboring countries. So we are really looking forward to see how we can find practical use cases with Slovenia or for example, Hungary in that sense. Uh, and for the final part of my presentation, I will just run through the few examples from COVID innovations or COVID uh, uh, solutions we provided. So of course, coronavirus.hr was the official government website, accompanied with a series of social media channels that actually provide the information on daily basis. And of course, open data also being updated daily for the analytics, for the analysts, for the journalists, public, general public, etc. Um, for the purpose of Croatian Health Public Health Institute, we have developed a year back, we have developed a digital platform for infectious disease monitoring, and it actually helped them do the evidence and do the contact tracing they did before that manually. So it actually enabled them to better identify and triage the pronounced symptoms of infectious diseases and persons with those symptoms that have not yet expressed the disease. So actually, this platform was one place where you can get information from who is in the quarantine, who is in the suspect, or being the contact, not yet confirmed case, etc. And connected to that, they really appreciated, so the epidemiologists of Croatia really appreciated help of this solution, digital assistant for citizens called Andrea.ai. It has been introduced a year back, and actually just recently, 4 weeks ago, it was retired because there was because of the good epidemiological situation, there was no actual need of it, but when it was tough, it really helped to provide the additional information to citizens by playing the role of the additional epidemiologist in Croatia. It was modeled by one of the leading Croatian epidemiologists. Of course, as many other member states, we have also launched Top COVID mobile app for exposure notification. Not that successful as in other states, so we have only 100,000 downloads until today. So it's almost a year now that it's been working, and so only below 2.5% of total population has been using it. So I see that there was a need to promote it more intensively in order for the general public to accept and to see the benefits of such a solution. But anyways, yeah, it's still working, and hopefully it will not be needed in the next wave of pandemic. And at the end, we have launched on June 1st the national system for EU digital COVID certificates. So both issuing and verifying at the borders and Croatia borders. You have more information on this link I have provided there, but it's just good to hear that, good to say that we have integrated the various data sources in order to actually comply with the business rules needed to both issue and verify EU digital COVID certificates in Croatia. And just to share with statistics, for the last 4 weeks, we have issued more than 250,000 certificates for Croatian citizens and residents. And this table on the right shows actually that more than 50,000 of EU digital COVID certificates have been have been verified at Croatian border. Of course, Croatians coming back home, that's the largest portion of it, but also from Poland, from Czechia, from Austria, etc. So thank you for your attention. Of course, there is a lot of things to be done in future. We are looking forward to future developments in eHealth. Really learned a few lessons from COVID, and of course, we will implement more functionalities regarding the central platform for e-nursing and e-emergency, etc. So thank you very much. I hope I didn't take more time than needed.
No, not at all. I think that's a fascinating national overview of progress in a really short space of time. And I think it's certainly another one just to add in terms of what we've heard already from Lorraine and from Mike, a really deep dive into the Croatian health ecosystem, and certainly to see, even basics like let's get rid of that stupid bit of paper that we no longer need, is one of the opportunities that we can grasp because of COVID. We're conscious of time. I'm going to move very quickly. So thank you for that, Herbo. I'm going to move now to Maria. And then hopefully if we get some time, then we'll come back and have a shorter fireside chat with the four of you. But Maria, please, over to you. We're going to hear from Maria now, who's going to talk to us, I think, about a wider view from the HSE about change management in digital transformation.
Give me 2 wee seconds to get my presentation up.
And while she's doing that, if you've got any questions, any of you, just pop them in the Q&As and we can come back later. Okay, wonderful.
Let me know, Andy, if you can see that okay. If you can hear me okay.
Yes, that looks grand.
Okay, hello everybody. It's always strange doing these because you can't see anybody, so you're literally talking to yourself to a screen, so it's always a bit of a weird one. My name is Maria McCann. I'm an organisational psychologist within the HSE, and I'm the director for the Health Identifier Service. And I'm going to touch, like Lorraine, Moshe and Hervé did, just on the IHI, the Health Identifier Service within COVID, and what we did from a human aspect of digital transformation, which is my passion as an organisational psychologist as well. So I will give you a very speedy tour of this. Okay, so just to let you know what the Health Identifier Service is, what we do is we provide the health service with identity management around individuals within the health service, and I'll go into a little bit more detail about those services and products that we actually have as well. The importance of what we do from an identity management point of view has skyrocketed within COVID, and it coincided with our sort of coming into the world of the service area as well. I'll show you a little timeline now in a second as well. How we came about to begin with was through the Health Identifiers Act in 2014, and that was enacted to allow us to establish and maintain two different registers. One is the National Register of the Individual Health Identifiers, which is for us as citizens, and another one is for the health service provider identifiers, and I'll show you a little bit more detail on what that breaks down into as well. The individual health identifier itself is a number that uniquely and safely identifies each person that is using, may be using, or has used a health or social care service within Ireland. It lasts for the lifetime of us as individuals. It is uniquely assigned and will never be allocated to anyone else. It's massively important as patient safety. It really is primarily a patient safety initiative. It also helps with efficiency and enables eHealth applications and privacy across our health services as well. The other product I'll go into a little bit more detail in is our health directory, and that's for the provision of identifiers for health service providers, locations, practices, people and organisations. A big thing that we can do and what we will be doing is around providing education and learning around identity management, the benefits to actually have it within each service within the health service, and it's all around data quality and how we can use that to the best of our ability across the health service as well. So I touched on earlier on the fact that we came into being in 2014 with the establishment of the Health Identifiers Act. But as you can see here, through 2014, there was quite a lot of technical work done around the Health Identifier Service, around actually pulling together proofs of concept, putting governance structures into place, and the technical build of the register that actually holds the information itself. The department that I run, the Health Identifier Service Department, didn't actually come into being until September, October 2019. And we then were established to actually build the service element and actually engagement with the health services with the health identifiers itself. There was 3 of us at that stage that started in September, October 2019. And as we all know, then in 2020, we moved straight into COVID. And the purpose of us from a strategic objective actually rapidly changed, like what Lorraine, Moshe and Hervé were saying as well. We were rapidly deployed into COVID and how we could actually efficiently, effectively work in that area for identity management within COVID testing and tracing to begin with. And then in December, we pivoted then to working into the COVAX environment and the vaccination program as well. And how we basically could link and enable in any way and service the guys in there any way at all. So all of our work since we pretty much have started in 2019 has been switched over to COVID. And there also was a big corporate centre review across the HSE that began just before COVID and has pretty much just finished there a few weeks ago. And our department, just for you to know as well, sits under the Office of the Chief Information, or the Office of the Chief Operations Officer. Lorraine mentioned her earlier on. Anne O'Connor runs all the operations for the HSE, and we sit in that area under operational performance and integration. And that area is accountable for driving integration across the operations of the HSE, how we enhance service delivery and performance, and how we use actionable insights using data-driven decision making. So a big part of what we do within the Health Identifier Service is all about utilising data, analysing that data and being able to make effective decisions across that. And that came into play quite a lot during COVID as well. And just for you to see as well, our corporate plan was delivered there for 2021 and 2024. And what we do within the Health Identifier Service, that identity management actually links into quite a few of the objectives. So objective 1, we're strongly linked into the managing of the COVID-19 pandemic. And objective 3, which is around improving scheduled care. If we can work with services such as National Treatment Patient Fund for waiting list analysis, we can actually use the unique number to look at the waiting lists and analyze those waiting lists and see how many people are across the different waiting lists uniquely using the IHI. We sit under the enablers 1, 2 and 3 as well. So patient service and user quality and safety is a patient safety initiative. Data and information is integral as well through the IHI and the health directory, and then under technology and eHealth to connect the eHealth systems using the IHI as well. So the IHI, as I've mentioned, is a unique number. It's very much linked to patient safety and lasts for the lifetime of an individual. It's made up of a number of data sets through the Health Identifiers Act, including your name, your gender, your date of birth, your PPSN. The health directory is another product and service that we have as well, and that looks at giving identities to practitioners, locations, services and organizations as well, and it's been massively impactful within the COVID journey as well. We worked very strongly with testing and tracing to give identity facility identifiers so that we could actually help provide identifiers for managing the outbreaks and using that for analysis of the outbreaks within the specific locations. It was used for vaccination centres. It was used for locations where vaccines were being delivered as well. So it was very strongly moved into that area. And with the identifiers, as you can see, it's the 4 different locations we spoke about, the people, services, organizations and locations. At the moment, they are not all interconnected, and that is what we'll be working on over the next coming years as to how we can interconnect and give really strong level analysis as to the people that work within the HSE, the organizations they work in, the locations that they all work in, and the services provided, and how they all interlink with each other. And giving identifiers for each of those 4 areas will give us a really strong analysis and a single source of information that can be pulled on by many, many different services across our health system. To give you even an example of some of the areas that we worked in within COVID, this is just a user story. We worked quite a lot in testing and tracing at the beginning. So if we had a record from Joe that came in, he had a cough and a fever and he needed a COVID-19 test. And just before I get into this, the IHI in COVID was the first time we were ever able within the Irish health system to be able to track someone coming into the health system, then being given a test as Joe was given when he went his referral into the COVID-19 test centre, using the information that he gave to correctly identify Joe to make sure he was the right person the record was being attached to, the IHI was attached. He was then giving a text message with direction as to where to attend the COVID-19 test. And that links back into the identity for the facilities. And we used the facility identifiers from our health directory as well. And that was using his address and error code to actually find the right facility to send Joe to that was closest to where he lived. The IHN then travelled as well with Joe into the labs, and it then was attached to his lab result to track that result. And then IHI was then used to ensure that Joe was being, the right Joe was being communicated with the results of his test as well. This is the first time in the health system we were able to use that tracking of the patient journey the whole way through by utilising the IHI at every single point within the COVID user story. Other areas that we were strongly linked into was around the identity management and the enrichment of information for records. So for example, this was Carl, and Carl had come in to his GP because he was feeling unwell. But in the state that he was in and feeling unwell, he gave an incorrect date of birth. And this happened within different areas and different use cases across the COVID-19 journey. So Carl confirmed his correct date of birth when he went to the test centre, but what happened is Carl now had 2 different records and his record gets stuck. So as it follows through in our system, he has to go into a validation queue to ensure that the right Carl is given the right information, because the first incorrect date of birth was clashing with his correct date of birth that he confirmed at the test centre. And that's where the health identifiers team really jumped in to utilise the systems and the processes that we had in there to ensure that people were getting the right contact information about their test result. And as you can see, in the last 6 months, around 40,000 similar cases were resolved by our team that had come in and got stuck, and 4.6% of those patients were actually positive. So we really needed to work very quickly in that environment to ensure that we were resolving these stuck records using identity management tools and processes to get that information out to ensure that positive people were self-isolating and had got the results in a really efficient and quick manner as well, and safe, very safe manner as well. So that was one of the areas that our team worked in. Another area was around the COVID vaccination, the vaccination program itself. People were going to be going on to our portal, which asked them for a lot of different data sets, and the explaining and that communication and clarity as to why we were asking for these data sets when you went onto the portal to get your vaccine. One of the big ones was around the PPSN, and we wanted to really clearly communicate with the public as to why the PPSN was needed, why all the data sets were needed, so that they could understand that this was to link them to their record, that the IHI was being used to find these data sets and then link you to make sure that it was safely linked to you for your record. And we had to do quite a lot of communication around that, and also very clearly communicating that our PPSN, which would be our public service number, was not needed to get a vaccine. It was just one of the data sets that we used to uniquely identify you, because there was quite a lot of concern around the fact if you didn't have one, and that didn't mean that you wouldn't get a vaccine, you just had to go through a different process to ensure that we uniquely linked your IHI to you as well. So quite a lot of conversations with the public, which hadn't been done prior either, because the IHI is like a back office ID that's used within our technical systems, and we had to sort of flip that to make it very clear. And the world of data sometimes is not very clear, and the different acts and associated legislation that come into play to get this, we had to try and make it as clear as possible for patients to understand. Just for all of you who are interested in the technical build-up of the IHI, this is how it looks in a very high level view. It's stored and administered in our IHI register, which is located in a service secure environment and is managed by our business service team. We use trusted sources as data sources to link the register with the IHI. So an example of a trusted source that we work with through our Health Identifiers Act and legislation is the Department of Enterprise and Social Protection would be a large trusted source that we work with. And then consumers are IT systems that are run by health and social care services that engage with us to actually get access to the IHI. And we go through quite a few security and business engagement testing and processes from both an IT side and a business engagement side with our team to ensure that that happens. And the CCT, the testing and tracing environment, and the vaccination system were two of the first engagements that we actually had from the service element of working with our consumer systems. And we'll be increasing that trusted source and increasing our consumer systems very much so at the end of this year, once we move to pulling ourselves a little bit more out of the vast amount of work that we're doing within testing and tracing, the COVAX, and now the digital green cert as well. There's some numbers to show you guys as well of different things that have happened within the environment. We have seeded the IHI with 35,000 GP records. We went from 3 people to 30, all remotely onboarded during COVID. We have had to move to a 7-day-a-week service to ensure that we were always there available for all the different records and to ensure that safe communication of test results. We've put the IHI against 1.23 million COVID-19 case tracker referrals. We've serviced the community lookup requests, which is when someone didn't turn up to an appointment, they were able to contact us to try and find the right number if they had the wrong number for that person as well. Huge amount of records within our health directory. Our health directory started off at around 4,000 records prior to COVID, the different facilities and locations that we had there. That has increased to nearly 20,000 records in our health directory during COVID, as we had quite a lot of different locations we had to work with for outbreaks, etc. So a huge amount of work has went on, like the guys have spoken about, massively pushed forward by COVID. That was a whistle-stop tour of the Health Identifier Service and what we're doing in there. And we're really excited to build on that now as we move out of COVID being our main streams and into a wider engagement with the entire health service. There's a lot to be done, but it's really exciting, the impact that can be made utilising the health identifiers across the different systems and services we have. I'm going to touch now a little bit, as I said, my passion as an organizational psychologist is around the human aspect of digital transformation. Just going to touch a little bit on some of the stuff that we did during COVID in there. So as a lot of you guys know, it is, when we look at any type of change, whether it's digital or just general change, it actually is mostly about people. 20% technology, 30% process, and 50% is really about how we focus on culture and organizational change. And a big thing for us was to try and look at that very strongly, very quickly within the COVID environment as well. And we moved from a lot of staff that were used to be working like most of the world in office environments to having to work remotely as well. And we needed to ensure that they were confident and happy that they were able to do that. In the role that I had just previous to the corporate center review, I was the head of organizational digital change for health business services, or shared services element. And when COVID hit at that time, as well as running the health identifier service, my role was to try as quickly as possible to technically enable the team within procurement to get our PPE, within HR to employ more HR staff for the COVID pandemic, and in finance as well. Those shared services element of procurement, HR and finance were hugely important for us to get up and running to ensure the health service could keep moving. That back office was needed massively. We had to get about 1,500 staff all set up remotely, and genuinely I would say 90% of those staff all worked in offices, didn't have laptops. We're all used to working in that environment. Once we technically got the staff home and set up and running, we had to create different PowerPoints to work with our managers. We had to explain to them how to manage online within their environment. And we had to create different sets of training for them to understand how they actually were able to do online work with their staff as well. It was just a different world to move into. So we realized very quickly that there was a big cultural shift to move into this digital world. So I reached out to some lecturers within TU Dublin, which is Technical University of Dublin, and an Irish platform called Innovation, and we created a bespoke online training solution very quickly, within 6 weeks. There was over €1 million collaborated and given freely pro bono from the different people that were involved in this, this project, and it was delivered within 6 weeks. We deployed it in May 2020 and sort of thought that there would be maybe 200 or 300 people that would want to actually avail of this module to learn how to work in this new world. We literally were floored. There was over 1,000 people registered in 2 days across multiple disciplines. It ended up, we had to close the registration. We didn't expect there was going to be that much. And we ended up having 2,500 staff, over 150 different areas that registered at the close of registration. And as I said, it was across every sort of discipline, from admin to GPs to occupational health therapists to surgeons. And they ended up with a level 6 diploma at the end of this for the online graduation. So again, just a little infographic showing you some of the people that were involved from TU Dublin, and the different hits, and the engagement was absolutely huge. As we said, absolutely massive amount of people who were craving that explanation of how they shifted themselves into this new environment. We graduated then in June, and there was over 1,000 people in the HSE that graduated, and we had on Taoiseach Micheál Martin was our guest at that graduate and everyone, and he again pointed out the fact that how well we were able to adapt, respond to this unprecedented situation, and the fact that we needed people to understand, to have the capacity and the confidence to be able to work from home. It wasn't something that we could just take for granted. Once we give them a laptop, they needed to understand how to utilize the tools, those digital tools. And I think that's, to be honest, the core of digital transformation. Whatever technology you're actually delivering, you need to make sure that people understand it and they're able to integrate it into their lives, their working lives in the right way. It's massively important. Then we had the cyber attack, and as one of my colleagues said to me, they won't ever say nothing else can happen. They're expecting aliens, I think, in the near future at this stage. When the cyber attack happened, all of our systems, our technology systems went down, and Maria was speaking about it earlier on with us as well, about how we're trying to basically look at different ways to get our teams back up and running on the different systems that are coming back on running. But at that stage as well, there was, for my team and some of the teams within HBS that I worked with, we knew that we could actually grab that time when technology systems were coming back up again to really get into that digital transformation from that human aspect again. So we ran very quickly from the beginning Google training programs, worked with Grow Remote, an amazing organization that I've collaborated with quite a lot, and we're doing benchmarking on remote working with the guys across multiple organizations. But we worked with them to deliver a Grow Remote module across 20 staff within my team and another team. And we also are just finishing putting through our staff on a project management course as well, when the cyber attack happened as well, to try and get them utilizing their own devices to be able to do project management. And they're going to have level 5 accreditation by the end of this week, that we're balancing with them getting back online as well. But really strongly, a real strong uptake from that as to how they can learn new skills to be able to support themselves in this digital future, new skills within project management, within data analysis, hugely important for my team, because that's where we live now, in that data world. And also collaborate with LinkedIn and Microsoft with a global skills initiative that they have, that's going to be made available to all HSE staff as well, as to how we look to the future. So when we have adversity, it's how do we turn that adversity into an opportunity to try and benefit our staff and support our staff, was a big thing that we jumped on within my team. And look, literally, it's about how we should be looking to all of our employees to skill and reskill throughout their careers. We're very, very aware that every 5 years that you should be pretty much changing 80% of what you know. And that's a huge number, and a huge cultural change for us as well. So it's how do we support staff to incrementally start looking at different ways that they can skill themselves and feel confident and comfortable in this new world that we're actually living in. And we need to grab this and drive this as leaders to ensure that people are actually given these opportunities as well. So huge range of benefits when we look at all we have to do in my world, which is the health identifiers service. But we need to ensure that we manage that and work with our teams in that to ensure that they're actually very well versed in the different skill sets that are needed to deliver the health identifier service as well. So it's a big thing. And that's me. That was a whistle stop tour there, Andy.
Thanks for that, Maria. Fascinating and fascinating for both sides, in terms of the identify a service, but also then, as you say, the important aspects of the human elements as well, which I think are just often forgotten. But no, a brilliant overview. So thank you very much for that. I'm conscious you got to run. Is that right? So, thank you for your time and patience as well.
No problem.
We've kind of overrun slightly, so I'm going to hand over to Dan. We're going to have a small little fireside chat. If you've got any questions, put them in the Q&A. Diane, I think you've got some already to go with.
I do. Hi to everyone. Thank you, Maria. Excellent presentation. Really, I enjoyed it. I just wanted to ask you, I know you're mindful of time. You said you had to go at 11:40. Just maybe a quick question around the key findings that you had on the culture. So again, I'm delighted to say that culture is really important as part of digital transformation. But what were the key learnings for you throughout the process?
Really interesting, Diane, and it's something that we're working on at the minute as well. I ran a survey with that organisation, Grow Remote and Qualtrics, and what we basically want to do is to actually benchmark what the new world of remote learning looks like. So to go from surviving to thriving, and as an organisation, how do we support our staff in that? So we ran quite an intense survey with our HBS staff that is now going to be taken and delivered to public sector and private sector organisations within Ireland, and we're going to create a benchmark from that over the next few months as well, just to support anyone that's interested in doing it. A big thing that we found was around connection and isolation. So how do we ensure that we're actually connected in this remote hybrid world? What does that look like for our different staff members? Communication, huge. It never ever goes away, no matter what world we're living in. It doesn't even have to be remote or hybrid. It's how do we communicate in an effective way? And the remote world opened up multiple channels. I think it made it even more confusing. So really getting honed into what communication channels are used for what and why and when. Technology, a lot of the time for my team, they felt that they got the technology worked very well. So the explanation of getting the technology, getting onto the systems, being able to remote worked very well, and specifically for my team. And so they were quite confident with that. It was more around the business processes associated with that and how we worked in that world. So connection and isolations is a big one. Communication was a big one, and leadership, understanding where we're going from a strategic direction, from a leadership direction, was something that we found within COVID as well, was quite important to people. So we had COVID, then with the cyber attack. So what does that look like? What is our strategic direction as an organization? What is that as a department? And trying to continually communicate that was big. The technology wasn't something people talked about in particular in the surveys we did, but it wasn't about technology for us.
Yeah. Okay, well done. Thank you so much, Maria. It was hugely insightful, and we really appreciate your time. And thank you for everything, all the work.
Thank you for having me.
Yeah. Thanks, Maria.
Chat to you soon. Thanks, guys. Bye.
Bye. Excellent. So I just have a question for Lorraine. Again, Lorraine, a really insightful presentation. Thank you so much for your time. So I just have a question around the digital transformation, and perhaps from the startup side, SMEs. How could they actually be involved in a process or actually reach out and be part of the Digital Academy, I guess?
Okay, so well, we work with a lot of SMEs at the moment, but the way I would, I see people just kind of contacting me in every way. Like I have people on like LinkedIn and people on Twitter contacting me, and I've no problem with that either. But really, on our website, we have a location where when you're an SME and you have an idea, that you can contact us there, and we bring you to the process. And like what we found with like we've worked with a lot of them, and we've been really successful with a lot of them. But the reason for that is because we kind of mentor them as well at the same time. So what we do is the processor in the HSE, it's a huge organization with 114,000 staff, 130,000 if you consider like people on contracts. So like, I mean, it's a really huge organization. And we have like controls and things that they have to do, like DPIA. So like any of the people I work with, the small to medium enterprises, I always walk through the DPIAs with them, data protection impact assessments. And I also the kind of around procurement and stuff like that. Like, so basically I think the assessment forms, the security assessment forms for this Chief Information Office, all of those things for a small company could be, could knock them back. But I think because we, the way we bring them to the process, we have them do a business case, and we bring them through a process called the Digital Solutions Review Board. Now, the Digital Solutions Review Board has national directors, like from people from the, Chief Information Office, but also people from quality, people from the CCO's office. And so we have different clinicians and, CHO area managers on it. And what we do is we bring this and we say, this is what we're presenting today. This is something that we think is a really good digital initiative. And we bring them to the process. And then we try to fund them to do some pilot projects. So that's basically the way we do it. So we kind of work hand in hand. So like, I'd be very close to the people I deal with, the Red Syncs and the Patient Empower. And it's kind of, to me, part of these teams that we take on, we work in synergy with them. So I think of them as an extension of my team. So we work that closely with them, that I consider that they're part of my team. And that's basically the way we'd bring them through. And yeah, so like, I mean, if anybody, as I said earlier, if anybody has any of these ideas that they want to talk to us about, we're open. And like, I mean, recently, I just touched on some of the small things there that we do. But like, I mean, there's some really brilliant things that's coming up. Like, I could go on about respiratory things we've done during COVID. I could talk about that all day. But one of the things that I seen recently that I thought was really interesting, someone contacted me on Twitter and said to me, I have this idea. It's like CAMS, a CAMS assessment for young people for mental health. And I just thought, that's great. And how do we, on Twitter, like she said, how do I contact you? So I said, here's my, private message me, here's my email address. And now we're working with these people. And, and this, like, that will actually help with the lists, the waiting lists. And the waiting lists there are huge. So like, I mean, if you've got something that you think is going to, be something that will be beneficial to the health service, come forward, talk to us. We're willing to talk to you and we'd be delighted to talk to you. So that's how you do it.
Thank you, Lorraine. That's great. It's great. It's very insightful. And I think it's great for everybody to hear, especially SMEs, because when we see the HSE, we think procurement and a big door. But again, how you interact with startups has always been amazing. So well done. Thank you for your time. Just a question around the Slovenia ecosystem with Moya again. Thank you so much. Great presentation in regards to what's happening in your area. I want to have a question around the telehealth side of things. How do you think that has changed a patient's journey to date around telemedicine? I think you're on mute. You're okay.
Sorry. Yes, quite a lot, because a telehealth solution I was talking about, but not really describing it, was developed years ago for a nursery home by Telecom, a mobile operator from Slovenia, and partners to enable, and now with this solution, they enable remote patient monitoring, which has already started being used in several hospitals. And as a service, it will stay for other treatments, of course. And there are several examples like this one. And since we are now in a process of, on a national level, on preparing eHealth national strategy, the telemedicine and its development will be one of the priorities for sure. And the positive thing is also that the telemedicine is widely accepted by the patients and by the by physicians, because it shows strong benefits by using it. So we strongly believe that this is one of the pillars, main pillars of our next eHealth strategy and focus, for sure.
Thank you, Moya. I couldn't agree more. And thank you again so much for your time today. We really appreciate it, and for the in-depth knowledge that you shared with us about the Slovenia ecosystem within the health. Thank you. So my last question is for, if I can pronounce your name right, Hervey. And I just want to again discuss a little bit around the electronic health records. You gave us a great insight again into Croatia. But what do you think would be the challenges that you're currently facing at the moment, and the solutions that you're embedding around those challenges?
Yeah, thank you for your question, Dan. So when we started piloting EHRs back in 2016, there was a lot of discussion with the professional societies of healthcare professionals about what should be part of EHR, what should not be the part of the EHR. Is there any more sensitive information that should not be disclosed to all health professionals, and etc. And also there was a legal gap in that sense. So the Act, Health Data and and Information Act we introduced in 2019 was actually a proper legal framework to stop piloting and actually roll out the EHR at the national level, full scale. But anyway, there are still some partial solutions in the sense what some of the health professionals, for example, emergency healthcare, can get from the EHR data and information from health records. So I think we have to work more in offering solutions to specific healthcare professionals. For example, emergency medicine, also some other specific parts of the healthcare. So they need to clearly see the benefits of what is there and how they can or their patient can benefit from using the information, all the data they have there. So we still have some extra step to do in terms of promoting the EHR and how the citizens can check their data there, and what's even the process of how to curate the data, or how to intervene towards the health system in order to make some corrections if needed, or if there is some wrong data or some not correct data input there. So yeah, the easiest way is to provide us a technical solution. So technically and network wise, it's all working, but you really need to round up the whole business process in order for the solution to make sense to each and every of the stakeholder in the pipeline.
Yeah, like very much great. And thank you so much for that great insight again into Croatia, and really important conversation to have around electronic health records from a global side of things also. So I just want to say thank you on behalf of myself and our team here. And if I pass you over to Angela and Andy also, thank you so much, really appreciate it.
Thank you
very much, Jan, and all the speakers. We had a quick question from Maria, and maybe Lorraine might be able to answer it. It was on the IHI. The question was, is it rolled out across the entire HSE, or is that a work in progress? And if Lorraine, you can't answer.
Yeah, I'll talk on behalf of Maria. They're doing Trojan work on the IHI at the moment. The IHI is something that's really essential for patient care, and it's in the service plan. There is support there for it. But as you know, we were pulled away by firstly COVID and then the cyber attack. So at the moment, we're using our systems for operational stuff. So that will roll out. There is a great push behind it. But at the moment, it will in the future, but it's not actually rolled out totally at the moment.
Yeah, and another question part of that, Lorraine, was would it be available to third-party suppliers, that would be, I suppose, vendors to the HSE or others?
No, I think under data protection, I'm very familiar with data protection impact assessments.
Sure.
And we are really, really careful. Like, I mean, the fact that we had a cyber attack, if you know the amount of paperwork you have to get through to be, to work with the HSE, it's amazing that they actually managed to get to do a cyber attack on us if you've seen the amount of paperwork. But the data protection impact assessment would be very careful with patients, patient health identifiers and patients information. And, it's only for a person. It's certainly not going to be going to anybody outside of the HSE or outside of their particular healthcare.
Thank you very much, Lorraine, on that, and for speaking today, and to all the speakers, and wonderful, and the CH Alliance on their collaboration and bringing this and making it possible. They're also helping us with that next one on cross-border funding. So out of Ireland, and we had a question earlier on, are these webinars accessible only locally? But that's not the case. We work much more broadly. They're available worldwide, and actually cross-border opportunities is something to tune into for funding and otherwise on the 12th of July. So thanks again, everybody, and thanks to the audience for hanging in there. Much appreciated. Thank you, everyone, and thanks.
Thanks.
Best of luck.
Thanks,
Stay
guys.
safe and well. Take
Thank
care.
you.
Take care.
Take care.
Bye now. Bye-bye.